Welcome to the Oral Health and Teeth Brushing Promotion for Children presentation. The importance of oral health is something that simply cannot be ignored. Poor oral health impacts our overall health and can lead to a number of illnesses and diseases. The World Health Organization defines oral health as a state of being free from chronic mouth and facial pain, oral and throat cancer, oral infection and sores, periodontal disease, tooth decay, tooth loss, and other diseases and disorders that limit an individual's capacity in biting, chewing, smiling, speaking, and psychosocial well-being. Here are some global facts about oral health. Oral diseases are one of the most common non-communicable diseases, or NCDs, affecting people throughout their lifetime. Severe gum disease is estimated to be the 11th most prevalent disease globally. In some Asian Pacific countries, oral cancers of the lip and oral cavity are ranked within the top 3 of all cancers. Social determinants have a strong impact on oral health. Behavior risk factors for oral diseases are shared with other non-communicable diseases, such as unhealthy diets high in free sugars, tobacco use, and harmful use of alcohol. Poor oral hygiene and inadequate exposure to fluoride have negative effects on oral health. Cavities are one of the most chronic childhood diseases in the United States. Children with poor oral health often miss more school and receive lower grades. 20% of children ages 5 to 11 years and 13% of adolescents aged 12 to 19 years have at least one untreated decayed tooth. Children from low-income families are twice as likely to have cavities compared to children from higher-income households. Several barriers still exist in achieving proper dental care in the United States, especially for underserved and vulnerable populations. These include shortages of dentists, misconceptions about preventive dental care, health coverage and costs of care, and low oral health literacy and education. Children seem more vulnerable due to reliance on parents and caregivers for dental appointments and proper hygiene and nutrition. In fact, children are often given sweets as rewards and in return end up with cavities or other dental issues. Common risk factors related to oral health issues are as follows: unhealthy diets high in sugar, higher consumption of sodas, fruit juices, sweetened powdered drinks, sports or energy drinks, honey, syrup, and fruit juice concentrate. These sugary substances are known to shift bacteria in the mouth and convert to acid, dissolving teeth enamel. Consuming sugar more than 4 times a day or more than 50 grams of sugar per day can add to the risk of oral health issues. There are additional risk factors for babies. Baby bottle tooth decay occurs in children exposed to sugary liquids for long periods of time, such as falling asleep with the bottle in mouth, continuously carrying and using bottles or sippy cups, drinking sweetened liquids throughout the day, or breastfeeding at night. Globally, oral diseases affect half of the world's population, with tooth decay and permanent teeth being the most prevalent condition assessed and can be prevented if detected early or by practicing proper oral hygiene. The diseases and conditions listed on this slide primarily impact people throughout Africa, Latin America, and Asia, but have the potential to occur anywhere in the world. Additionally, these chronic conditions and diseases have been linked as a result of poor oral health. Periodontitis, HIV/AIDS, diabetes, endocarditis, cardiovascular disease, birth complications following pregnancy, osteoporosis, Alzheimer's, eating disorders, rheumatoid arthritis, and cancer. The impact of poor oral health is greater than most realize. Over 50 million hours of school are lost on an annual basis due to dental issues. According to the American Surgeon General, oral disease is an issue not discussed often enough and described as the gateway to general health and well-being. Oral health issues have assisted in the creation of CHIPRA, or the Children's Health Insurance Program Reauthorization Act of 2009. The funding provided by CHIPRA has assisted in the prevention of diseases, promotion of oral health, restoration of health, and treatment of emergency situations. Successful interventions include educational programs that place an emphasis on the essentials of proper oral health, demonstrate techniques to motivate individuals to lower sugar intake and consumption of acidic beverages, and highlight the significance of brushing and flossing. These interventions can be provided throughout communities and school corporations using media such as literature, television, news articles, videos, etc. Additional knowledge pertinent to promoting proper oral health involves the foods we eat. Necessary nutrients include protein, vitamins A and D, calcium, phosphorus, ascorbic acid, fluoride, iodine, iron, and B vitamins. The recommended best practices for child oral hygiene are as follows. Brush teeth twice per day with fluoride toothpaste. Drink tap water that contains fluoride. Apply dental sealants when appropriate. For children less than 6 years of age, watch them brush, making sure they use a pea-sized amount of toothpaste. A smear of fluoridated toothpaste is all that should be used for children under the age of 3. Flossing should begin when 2 teeth touch. All children should see a pediatric dentist and establish a dental home by age 1. Protective nutrition practices include milk or water as primary beverages, sippy cups offered at 6 months of age and bottle use discontinued by 1 year, and encourage a well-balanced diet low in free sugars and providing adequate fruits and vegetables. Protective environmental practices include water fluoridation, regulation of public marketing and promotion of sugary foods to children, taxes on sugar-sweetened beverages, and promoting healthy settings within cities, workplaces, and schools. Health promotions. An example of poor oral health promotion is the campaign entitled How Oral Health Affects the Body by Insight. This campaign illustrates that pregnant women with periodontal disease who rinse with a non-alcoholic mouthwash are less likely to deliver prematurely, and that women who have periodontal disease take longer to conceive. Overall, people with periodontal disease have an increased risk of heart problems and coronary artery disease, dementia, diabetes, lung conditions, and pancreatic cancer, especially in men. Insight's campaign provides information on several oral health risks, but gives no mention on how to address efficacy or modify health behaviors. It raises the level of perceived threat and fear without providing instructions on how to protect against the threat, which can likely produce a fear control process reaction. The theories this promotion slightly relate to are the IMB, Information Motivation Behavior Skills Model, and PMT, Protective Motivation Theory, presenting the threat of illness or disease to inspire attitude change, but in this case, not offering solutions or suggested actions. An example of good oral health promotion is the campaign and music video Brushing is Fun by Southwest Virginia United Way. The strengths of this campaign include addressing self-efficacy and knowledge in a kid-friendly manner, using the health belief model, the perceived threat barriers of oral health and expected net gain of fun brushing to ward off cavities and improve fresh breath. The IMB model portrays the information, proper brushing, and fun dancing song with the tooth fairy, the increased motivation, will motivate children to practice proper oral hygiene, the positive health behavior. The campaign's relatively small target area is its limiting factor. The award for excellent oral health promotion goes to the Oral Health Foundation's National Smile Month, the largest and longest running international campaign promoting oral health. This campaign offers a variety of media, including podcasts, posters, articles, toolkits, and the assistance of a helpline. The program is well recognized and applicable to all ages. It is successful in increasing self-efficacy given the various teaching methods offered. The model this campaign encompasses includes the HBM and IMB, raising awareness of potential threats of poor oral health while providing education, confidence, and motivation to prevent poor oral health. Additionally, social cognitive theory is applied, supplying knowledge directly based off observing others, the vicarious experience, strengthening self-efficacy regardless of behavioral capacity, the multiple teaching resources, and helping with goal formation, examples, the 2-minute brushing challenge and the opportunity to be nominated or nominated others for their smile. The key takeaways in reviewing oral health promotion campaigns are: the good oral health promotion campaign discussed oral hygiene using a common figure believed by young children, the tooth fairy, and that children are motivated by their peers. The music video made learning these hygiene methods fun and easy to memorize. The excellent oral health promotion campaign encompassed the concept of proper oral health by utilizing various modes and techniques of promotion. Proper oral health behavior is essential. Children especially are at risk of poor oral health diseases due to diet, which can also increase risk of a multitude of illnesses and diseases as they age. Increased health promotion campaigns, such as our excellent example, using constructs like self-efficacy, knowledge in relation to behavioral capability, motivation, goal formation, and outcome expectations, the realistic payoff, mostly SCT constructs, are best suited when applied to oral health promotion in children.